Okay, today I'm going to talk about a couple points of cancer screening. And this is crazy. When I first learned breast cancer, okay, focusing on breast cancer for step 1, it was 50, but apparently the age is now younger and younger. So ACS actually have their website listed as 40, and a couple of resources also mentioned 40. But I feel like the COMLEX or step 1 USMLE is not as updated in terms of their question bank. There's also US Preventative Service Task Force. So these two resources. I think the main strain is still that 40 being an optional depends on patient's preference, and 45 is the age we want to suggest patient to start screening for breast cancer. And then 55-year-old is when they will do a every 2 years screening, supposedly living healthy and no other crazy condition until the age of 75-year-old, or if they have a life expectancy of less than 10 years, then we will just advise patient to stop screening. Any point you get a suspicious result from mammogram, screening mammogram, you would proceed with an ultrasound, and you use this is called BI-RADS score as a standardized radiologist rating from 0 to 6. This part is for your study pleasure. I don't think they test that frequently on step 1 exam, at least. Maybe later on shelf and step 2 and 3. But on top of ultrasound, you will do a core needle biopsy. And Gordon Beyond mentioned that breast cancer being the second leading cause of death for female, which was true up until this point still for the year of 2025. So for female, the first leading cause is lung cancer, for male as well. And then breast cancer being the second leading cause, male is prostate. So it's like almost sex specific type of cancer for mortality. And then the third leading cause for mortality is colorectal cancer. I'll just abbreviate as CR. And you will just swap lung cancer from the second leading cause of mortality incidence, lung cancer from prostate cancer, and then colorectal remain on the third place. And I saw this rhymes really well with the mnemonic of CEA tumor marker. There's a mnemonic of club of CEA tumor marker, which are colorectal, lung cancer, LU, B, breast cancer. There are other screening ages you want to be aware of. So I would know these, and then I would know for prostate cancer, and I'm only listing the guideline from USPST. Prostate is about that age male, first of all, and it's optional, so shared decision making. Age of 50. Lung cancer you want to know because it shows up as a high yield point. It's also age of 50, but it follows what's it called, a 50-20-15 rule, 50-20-15 rule. And start age of 50 if you have 20 pack year history, but if you are currently smoking, then you quit less than 15 years ago. Less than 15 years ago. And today's technology, they're using what's it called, low dose CT chest x-ray, which minimize the radiation exposure for patient, which I thought is pretty cool. There's a COMLEX on one of the COMSA form. There's a question on a patient coming in at the age of 45. What would you do? Like, everything presentation is healthy, and the answer was lipid. There was like CBC, cholesterol, and some other choices listed. Breast screening wasn't listed, but the answer was cholesterol. And then I made a mnemonic: lipid screening at 45, lipid at 45, keep the heart alive. Something, hope it's helpful. Colon scope at 45 keeps the colon thrive. Colon at 45, keep the colon thrive. There's another question, talk about a smoker patient coming and they at the age of 65 and they screened for abdominal aorta aneurysm, which I never seen that showed up in any other question bank, but just keep that in the back pocket. Osteoporosis for 65 for DEXA scan to minimize fracture risk, and cervical cancer, you always do pap smear, so that's cervical pap smear. That's since the age of 21 all the way until 65. But starting age 30 is you would only do every 3 years of pap smear. Prostate is a case by case, yeah, we talk about, it's optional basically, but they focus on age of 50. Colorectal is 45, and this is what I learned from, yeah, there we talk about it in school as well, and that's every 10 years. That's just some general rule. I'm sure there are other screening guidelines, and they do change year by year, know like a general picture, I think it'll be helpful for testing purpose, because QBanks don't get updated right away to the newest guideline. Just keep that in mind. And you are responsible for knowing the epidemiology part, know male, female, but also know children. When they have mortality, has nothing to do with these guys. It's leukemia, CNS, and neuroblastoma as from top down. Those are listed in first aid, so just check out the resources.